Good evening, one and all. Welcome to Excelsior 20, South Asia's largest medical conference. Today, for the academic session, we have the one and only Dr. Rohan Khandelwal, who's also a breast cancer surgeon working at CK Birla Hospital, Gurgaon, Delhi, and also a national level faculty at Marrow. Dr. Rohan sir is an erudite and a highly talented breast cancer surgeon specialized in benign and cancerous breast disorders. He brings over 17 years of experience and has done more than 500 breast cancer surgeries. He has authored 22 articles in various national and international journals, authored one book, one video, and two co-authored chapters. He has also 17 years of experience with Safdarjung Hospital, Max Healthcare, Mazumta Show Cancer Center, Narayana Hridayalaya, and W. Pradiksha. He has obtained his MBBS and MS in general surgery from Vardhaman Mahavir Medical College and Safdarjung Hospital, Delhi. He has taken his MRCS from Royal College of Surgeons. He has taken his fellowship in breast oncology from Mazumta Show Cancer Center, Narayana Hridayalaya, Bangalore. Also has a hands-on clinical fellowship in advanced breast surgery at the AILO Breast Center, University of Maryland, Baltimore. He is also the head of medical affairs at Korofi, medical director at UE Life Sciences, editor-in-chief for the New Indian Journal of Surgery and Journal of Young Medical Researchers. And moreover, he is an amazing teacher, a wonderful human being, and the best supporter to his patients. It's an absolute inspiration and pleasure for all of us to have you with us today, sir. A warm-heartedly welcome to Excelsior 20 on this academic workshop to talk about the voyage through the prospects after MBBS. Good evening and welcome, sir.
Thank you. Thank you very much for such a kind introduction. Hi, everyone. I'm honored to be here. Thank you for having me on this platform. And I hope everyone is keeping safe during COVID times. We all are going through tough times. I hope all of you are keeping safe. So without much ado, I think so if the topic which is being given to me is regarding career opportunities regarding after MBBS, the non-MD/MS career opportunities. You already know about your PG branches. So I'm going to be talking about other opportunities which are there. Before I start, if you people have any questions, why don't you start asking your questions, and then I can start talking about other things in between.
Sure, sir. I'll keep you updated about the questions if they come up.
Okay, perfect. So look, if I talk about myself, I have actually taken a non-traditional path when it comes to pursuing a career. So of course, yes, I wanted to practice as a clinician and as a surgeon. This I was pretty clear since second year undergraduation that I wanted to do surgery. And by the end of final year and first year of my post-graduation, I was clear that I wanted to do breast cancer surgery alone, which nothing else. So that at that time was, not a very common career option. And the reason why I'd taken it was because I had family members who had suffered from it, and I had a close friend whose mother and her aunt had suffered from breast cancer. So that was my inspiration of taking up this branch. And now 9 years down the line, I have no regrets at all. It has been a very good career option. Now, because my branch doesn't entail a lot of emergency work, it also gave me an opportunity to help out in a lot of startups. So that is one of the opportunities which you can pursue after your MBBS. That is be part of a startup, a healthcare startup. And given the COVID era, these healthcare startups are mushrooming, and also they are flourishing at this time. So the first startup I helped out was Curify, and Curify was a doctor's networking app. I was the medical director for them, and I used to juggle my time between my practice and helping out at Curify, and I helped them go from a user base of almost 0 to 2 lakhs before I left the company and joined other startups. The other startups I've been associated with are 1mg, UE Life Sciences. In UE Life Sciences, we developed a low-cost breast cancer screening tool. And of course, Marrow, before it got funded heavily, was also a startup. So I've been associated with Marrow as well for quite some time. So career opportunities are there in the startup space. They can either be part-time opportunities or full-time opportunities. You can even work in a startup along with your clinical practice. So that is one area which you can explore if you're looking for alternate options. What is a healthcare startup? So a healthcare startup, look, startups are basically young people who want to pursue entrepreneurship. They will come up with an idea. They get funded initially by angel investors, and then they gradually start working on that idea. So like Daily Rounds, which Dr. Deepu started, was the parent company which started Marrow as well then. So Daily Rounds was basically a company set up to have interactions amongst doctors and also to disseminate authentic latest information regarding all branches. So those are the kind of startups which are there. 1mg, which is the largest online pharmacy in India, was also a startup when they started off. Of course, now it's become a very big company. So somebody wants to know about USMLE. What is better, pursuing PG in India or going abroad? Well, that's absolutely your decision. I can share my insights on this. I had cleared my USMLE during my internship. So primarily I was preparing for US residency. It's just that I cracked the Indian exam and then I somehow I stayed back here. Of course, I went for a fellowship in between, but primarily I was preparing for USMLE. So if I have to talk about the pros and cons of, say, USA, UK, Australia, USA, of course, the biggest thing which why people like to go there is the quality of life, and good earning opportunities are there. So those are the prime reasons why people want to go there. And if you want to go and settle there, then the best time is to go after MBBS. Don't waste your time doing a PG here, because you'll anyways have to repeat your residency once you go there. So go there straight after your MBBS. That's the best time. Of course, now saturation is occurring in some of the branches. Although after COVID, a lot more opportunities will come up, and there would be a lot more seats for foreign graduates in the coming years. UK, on the other hand, UK, you can go either after MBBS, you can take the PLAB route and then appear and take up a branch, or you can do your specialization. Like I'd finished my MS, then I did my MRCS. So that made me eligible to get myself registered in UK as well, in the General Medical Council. So both the options are there, either after MBBS or after doing a PG and then going there. In UK, you can settle down easily, but the problem is that to get a consultant number and to get a teaching number, that's the difficult part in UK, and that can take up to 7, 8, 9 years as well in some branches. Australia is a smaller place, less number of seats are there, and initially you're posted in the periphery. So, to work your way up into a central city might take some time, but again, the quality of life there is excellent. Okay, somebody wants to know about the strategy for next. I really don't think that this is the best place for me to discuss the strategy regarding next, but just a few words of advice that next exam is going to be right after your final year. So up till now, the batches are appearing for exams after their internship, right? So they get that 1 year of internship to prepare well. But here the exam is going to be right after your MBBS final year. So you need to finish all your 19 subjects by the end of final year. You don't get that buffer year of internship to prepare those 19 subjects. So you need to study in a smart manner, and you need to start your preparation as soon as possible if you want to get a good rank in the next exam. Other European Union countries, well, Germany does have some opportunities, but then you need to know the language there. Without knowing the language, then you can't settle there. Okay, somebody is asking, I would like to work for the Red Cross Association. How do I go about doing that? Right, good. So that's another good career option. You have Doctors Without Borders, you have Red Cross. These are organizations where you can work. you can work either after MBBS, or you can even specialize, and then they have specialized postings as well. I have a friend of mine who works in Doctors Without Borders, and she is a surgeon. So, she's posted in remote areas of the world, but the posting is really exciting. You get to do all kinds of surgeries, right from delivering babies in a rural setup to managing, gunshot victims. So it's a challenging job. Somebody who's an adrenaline junkie, I would say it's Doctors Without Borders is best suited for them. Of course, the Red Cross also, you have these postings which can be there in remote areas as well as well-established countries. So to answer your question, you can go right after MBBS, you can apply for these, or you can go after specialization. There is usually an interview process which is involved, and they all are looking for a good resume. So if one thing which I can impart from this webinar is that don't only focus on studies. Build an overall profile, try to do some research, try to get some publications, have a strong resume, and that will really be helpful for you in the future. So somebody is asking, is MCH after MS a must to survive in a top city in India? Well, I haven't done an MCH and I am doing, I'm happy with the work which I'm doing. So it's not mandatory to do an MCH. Of course, what you need to understand is that the more number of degrees which we are getting, of course, we are getting better training. We are getting a degree in front of our name. So the initial job opportunity and the entry becomes easy, right? The entry into a job or into a corporate hospital becomes easy. But the way you grow your practice doesn't depend on how many degrees you have, right? It depends on how good a clinician you are, how good your communication skills are, how well you can relate with the patient's problems, and you can help them all throughout their, treatment journey. So degrees won't determine your end result in the practice, but yes, they give you a good entry level job in a good place. Right. Like going after PG. So, okay. How did I prepare for USMLE, and can I share my experience during residency in US? So I prepared for my USMLE during my internship, while doing internship at Safdarjung, which is one of the heaviest internships. So I gave myself 6 months for step 1, which is good enough. If you've read well during your MBBS, 6 months are enough for step 1. For clinical skills, when I was doing my rotations after my step 1, I did 3 months of rotations at Harvard, Cornell, and Hopkins. So immediately after that, I gave my clinical skills exam. So, whatever I learned during my rotations, I gave the clinical skills exam based on that. And the CK exam, step 2 CK, did not take more than 3 months. So yeah, that is that is the time which you should devote to each of these steps. Yes, this is provided you've read well during your MBBS and your concepts are clear. Otherwise, add a couple of months here or there. The resources which I use for USMLE, I used standard textbooks all throughout my MBBS, and I used Kaplan notes, primarily Kaplan notes and UWorld question bank. Those were my primary sources. Of course, I also use first aid, and I used to add more points to my first aid, whatever points I hadn't read in standard Kaplan notes and what I was seeing when I was solving questions. I used to add that to my first aid. So my first aid became pretty bulky, but that was my single point of revision or single source of revision just before the exam. Is PLAB or the route to Germany comparatively easy after MBBS? Well, you have to clear MBBS if you want to go there. Without MBBS, you can't apply to these places. What are different career options other than PG, USMLE, and PLAB? Right. So I've already told you about startups. Pharmaceutical companies, they hire a lot of doctors, and you need not be an MD pharmacology. So otherwise also pharmaceutical companies hire a lot of doctors. Um, the favorite amongst doctors is, of course, civil services. So a lot of doctors appear for the civil services exam after their MBBS, and uh, that is one of the options which you can go to. MBA is coming up as a big option. My brother, who is an MBBS, then did his MBA from ISB Hyderabad, and he settled in Hyderabad. He's working with the Apollo group of hospitals, and he's pretty happy with his life. Similarly, I know other doctors who were with me at Sabdajan. They've done their MBA, and one of them is working with an investment, is into investment banking, and they're basically helping out investments for health tech companies. So yes, MBA is also another career option, which is that. What is the process of PLAB? So detailed process of PLAB, I don't think so I can discuss the detailed process of PLAB. You can always send me a message later on and I can discuss how to go about it. So next year, so next exam, they're saying from 2022, they should have the next exam. But we don't know post-COVID whether they postpone it or not. Right. How about specialization in US after completing your PG in India and then coming back and serving in India? So Rohan, if you want to go there just to enhance your skills, then you can do what I did. I went for a fellowship. When you're going for a fellowship and you haven't done your residency there, it's very difficult to get a job there. So, you know, you're going with a very clear mind that I'm just going for skill enhancement and I will come back and work in my country. So that you should have very clear focus. But if you want to settle there, then you will have to repeat your residency if you want a job there. Research after MBBS. So, well, yes, in India, unfortunately, core research is not a very well established field. But if you want to do research after MBBS, there are plenty of opportunities in America. And in fact, a lot of doctors use that as a stepping stone for their residency application, right? Especially if somebody is applying to a surgery residency or a neurology residency, which are difficult to get there, then they do 1 or 2 years of research there in America. And just 1 second, I'm very sorry, just give me 1 second. Very sorry. So, so they do 1 to 2 years of research there, and this research is initially unpaid. You can easily get it. You can write to the research director there, the one who's heading the lab, and they usually require research associates. So if you're willing to work for free for some time, they'll be happy to take you in. And after some time, they do pay you some allowance as well, so that you can survive there. And research also can be on different visas there. You know, if depending on the duration of the research, if it's a short-term research, you can even do it on a B1, B2 visa. But otherwise, sometimes longer-term research can be done on a J1 visa as well. Which path do you think is the best route to go to UK, PLAB or MRCS? Well, if you're applying in surgery, I would say MRCS, because, you know, once you've done your post-graduation, you've done your MRCS, you easily get your GMC registration. So I feel that that is the easier path. So Canada also is on the similar lines as USMLE. The you know, path is pretty much the same. Again, the problem in Canada is you don't get posted, or you don't get a job in the main cities. You always have to be, you'll be posted in the periphery, and gradually you have to work your way up into a central city. Football club doctor abroad, right? So, you know, a lot of us think that we want to do sports medicine and we want to be part of of an IPL team or a football team. So actually, the full-time employees are physiotherapists, not doctors. So they have full-time physios with them who specialize in sports medicine. But yes, sports medicine is a great career option, not only in India, but abroad as well. And to pursue sports medicine, you'll have to do orthopedics and then go into sports medicine, which would involve a lot of arthroscopic work, which you'll have to focus on. Yeah, armed forces is a great career option in India, and those who are willing to join the armed forces, you can apply for AFMC, and usually the postgraduate seats there remain vacant for till late ranks as well. So you can join AFMC, do the short service commission there, and then decide whether you want to continue there or you want to come out and practice in the private sector. So good opportunities. Another interesting branch is aviation medicine. And aviation medicine, I know a junior of mine who's finished his aviation medicine now, and you're primarily based in Bangalore, but you get to do a lot of flying, and you work closely with the Indian Air Force there. And he's been applying to some fellowships in NASA as well, and he's saying that that is also a path which you can take to go and do some work at NASA. So aviation medicine, yes, is an upcoming thing where you work closely with the Indian Air Force. Do you think there's a lot of difference? Mridula is asking, do you think there's a lot of difference regarding approach to surgical managements in India or abroad? Does studying in India or foreign affect your practice related to the above topic? No, I don't think so. So these days you have pretty standard guidelines which are there. And in terms of surgical skills, yes, of course, I mean, the latest equipment which is being developed there, we'll get it after a few years. But the techniques, I mean, the guidelines are pretty much uniform all across the world. So I don't think so there's much difference. Okay, Mohita has asked an interesting question, how to decide a specialty. Well, I feel that to decide a specialty, it's different for different people. Like for some of you, you'll know that you are that a typical type A person who likes to be very competitive, and you don't get scared by blood. You don't mind, cutting up people. So those things you pick up when you go for your postings, when you go for your internship, you will get a sense of which branch do you like. And I guess the first broad division is whether you want a medical branch or an interventional or a surgical branch. And I guess once you've made that decision in your mind, then the options are in each one of them. Then you focus on their postings, and during internship, when you're working in those departments, you'll be able to make up which branch to choose. But yes, one thing which I always tell students that if you've always wanted to be a surgeon or a gynecologist, just because you got a top 10 rank doesn't mean that you have to change and now take up radiology, right? So don't choose a branch because of peer pressure or because of what your family members are saying, that this would be this would be a branch which would pay you more, or you'll settle down early, you can get married earlier, you can probably travel the world more. Don't base your decisions on those things. Have a very logical approach and don't change your mind. If you want a particular branch, stick to it. I have seen students who regret their decision when they take a branch because of peer pressure or family pressure. Shloka is saying, if somebody scores in next, can they appear for the exam again? Yes, you can appear for the exam again. Research, I've already spoken about research. So currently in India, I guess the only research which you can take part in is the ICMR research program, the short-term research, the STS research program. The good thing about STS is that, you are getting encouraged into research, and ICMR is giving you that opportunity. The the drawback regarding that STS thing, which I don't like, is that it's just of 2 months duration. So, you know, a lot of students are just doing that STS work just to get that certificate. Please don't do research just to get a certificate. Your end goal should be that you publish your research. So if you've taken up a study, if you've started some research, please continue it. And it should end with a publication. That should be your aim. Also, look, when you're working in a government hospital or any hospital for that matter, not everyone has an inclination towards teaching or research. So whenever you're doing a research program, or make sure you choose the right mentor. So find out who are the doctors in your hospital who are inclined towards research, towards publication. And it's best to do the research under their guidance so that, you know, they can guide you properly and you can get a publication in the end. Okay, so I've answered these questions. So PLAB process, you know, I can't discuss in detail here. I will, you can contact me. Otherwise, I'll let you know how to go about preparing for PLAB. Okay, research, Canada, this sports medicine. How to go about for civil services. So civil services, you will have to appear after your MBBS. So one is to stay up to date with the current affairs. So that you have to do all throughout your MBBS tenure. And then, you know, there is specialized centers who give coaching for civil services exam. It's best to join one of those institutes and to know the details of how to go about it. So one of the papers would be your medical papers, but there would be other papers also which you'll have to appear for, like history, current affairs. So for all those, you need proper guidance. For next, you should finish your course 6 months before your final year gets over, so that you can revise. So USMLE, Krishnendu, the best is to log on to the USMLE website and go through the details rather than going through any agency. Yes, Marrow is already next ready. We will be adding more content pertaining to next in the coming few months. It was in the pipeline, but due to COVID, it just got delayed. You know, mainly the clinical examination videos, more correlation videos amongst faculty. So those would be posted soon. So Ananya is asking, do we need to clear USMLE if we want to do a fellowship in US after PG in India? Good question. So Ananya, there are two types of fellowships which are there. You have accredited and non-accredited fellowships. If you want to do an accredited fellowship where you get a proper fellowship certificate, then you need to clear your USMLE. But if you just want to go for a non-accredited fellowship, which is more of a glorified observership with some hands-on work, then you need not clear your USMLE. Pranita is asking, how do you view medical entrepreneurship 10 years down the lane? Well, I see it flourishing quite a lot because, you know, health problems would just keep on increasing. And COVID has really reminded people that, you know, they have to pay due attention to the healthcare services. And more health tech and more ideas would come into the healthcare space, into optimizing the output which we can get from our services, and you know, how to improve the services as well. So I feel it's very important that people do explore new things in the health tech space. So to get your research published, your research should be a meaningful research. And like I've told you, the mentor who's under whom you're doing the research will be able to tell you which is the target journal for this research. Your journal should be an index journal. Some of you must have heard of PubMed. So PubMed is one of the indexing agencies. And if your journal is PubMed index, that gives you a lot of credibility that the article has been published in a good journal. After doing MRCOG, can we settle and practice in Canada or America? You'll have to repeat your residency there. Just based on MRCOG, you can't do that. Direct PG in CTVS neurosurgery possible or without going through PG in general surgery? Yes, you have 6-year plans where you can directly do CTVS or neurosurgery or plastic surgery. Those are mainly DNBs, barring your AIMS. AIMS has a 6-year course of MS and then neurosurgery MCH. Otherwise, they're mainly DNB seats. Some of the institutes are good, like Narayan Hridayalaya is good for CTVS. Similarly, Apollo is good for neurosurgery, but not all institutes are good for these 6-year courses. Also, these 6-year courses, you might come out as a super specialist, but the people still rate those who've done their MS and then MCH a shade better than those people who've done the 6-year course. So still that discrimination is slightly there. How could we bring about a change in the Indian healthcare system? Well, I think so. Look, I feel that the Indian healthcare system is undergoing a lot of change, both the government sector and the private sector. And COVID was really a wake-up call for everyone. So, as doctors, we are getting a lot of attention, but we are facing a lot of criticism as well. Now, I know we always try to do our best, but all I can say from my experience is that spend more time with patients. And I guess the biggest reason for most of the litigations and the stories which you hear is lack of time spent with the patient and their family members. So just 2 minutes extra and just, a polite word can mean a lot to the patient. I deal with a lot of cancer patients who have, their disease lasts for a long time, especially those who have metastatic disease. And, sometimes you do get frustrated, but you have to sometimes put yourself in their shoes and think what's going through their mind and really help them out. So I guess one thing which I would request all of you to do is to spend more time with the patient, listen to their problems. That's more important. Yes, COVID era will affect studies abroad, but it can be in a positive and a negative manner. The negative impact will only be for short term, like this year only. But the positive impact for the next few years is going to be that there are going to be more opportunities. How to manage the preparation for final prof exams and next exam? Well, there's not going to be any final prof exam. That's the best part. The final prof exam is going to be replaced by the next exam. So you won't have any final prof exam. Is it necessary to be the best? Like, is my marks in India a factor for getting me selected into some of the institutions? Of course, you have to get a good rank to get a good institution. I've already spoken about how to go about getting into the army. You can either go right through your MBBS into AFMC, or you can join the Short Service Commission when you're joining your PG in AFMC. So financial requirements for clearing USMLE are mainly the fees which you have to pay for the exams, which is I'm not aware of the latest fee structure, but I can tell you what it was a few years back. It required an investment of around 3 to 4 lakhs. And, you have to travel there once for your clinical skills exam. So overall, you're looking at an expenditure of around 6 to 7 lakhs at the most till the time you bag a residency seat. What are your thoughts about a mobile clinic? It could be a good way to reach out maximum needy patients. Yes, that's absolutely a good idea. In fact, some organizations are working on it. There was an organization which, I know of somebody who had started a mobile clinic in a Tata Nano car. in Mumbai, and they had multiple such cars going across the city to help out people. It's just that you have to, whenever you think about an idea for a startup or a health, something which you really want to grow, think about scalability, right? A mobile clinic is going to be, you'll have to invest a lot in cars or those ambulances or those vans. So always think of scalable ideas, and that would only come when you apply a lot of technology into the startup, and then you think about things. So I guess the way doctors think initially, our mindsets are a bit different from what how entrepreneurs think and how this healthcare is being scaled up. So we really need a crash course in that before we venture into something like this of our own. So Navy, Army is through the same course which I told you, that STS thing is for Navy, Army, both. Community medicine is a great branch. In fact, if you ask me 3 or 4 branches which are going to be which are going to do really well in the next 10 to 12 years, I would say number one is going to be psychiatry. And with the lockdown has taught us that there are a lot of problems when you're just entrapped in your home for a long period of time, and people are going through, they're losing their jobs, personal lives are not going well. So psychiatrists would do extremely well. Oncology, whether it's surgical, medical, or radiation oncology, is going to do extremely well in future. Community medicine, because after COVID, the preparedness for such disasters in future would have to be better, and they're going to be more robust community level programs. So yes, community medicine also I feel is a great branch for the future. So yes, WHO, UNESCO, there are career prospects. There were very good prospects, say 10 years back, when India was still being considered as a developing nation. But what has happened is that a lot of funding of WHO and UNESCO is now going to other developing nations. So the number of projects which they were running here have actually slightly reduced. So that ways the opportunities are slightly less, but still you can bag a job in WHO, UNESCO. So Nanya, NIMHANS is the best center for psychiatry. I've already told you, I feel psychiatry is going to be the branch of the future. Yes, voluntary work does help in your resume for USMLE, but that's just a minor aspect, not the major aspect. So, whatever help you're doing, just make sure you note it down and you can write it down in your resume. I applied for STS twice, but did not get selected. You can still publish your research. So, I mean, I never did STS, but I still, by the time I joined my internship, I had 5 PubMed indexed publications. So nobody is stopping you from PubMed indexed publications. Forensic in India is an underdeveloped branch. I feel that, the CSI which you want to become is, those are not, it's not a rosy picture in India. The CSIs which you're talking about in America, those are basically forensic pathologists. So they have done their pathology and then they, get into forensics. India, I don't think you can become a CSI, which you want to emulate after watching that TV program. Okay, publications, I've already told you. You do get scholarships abroad. I mean, scholarships when you're going for your externships, you can get for research work, you can get some allowances there. Yeah. Okay. Right. So extra things we can do in MBBS. Simran is saying, so extra things, of course, I've told you research is one of them which you can do. You can do some voluntary work, help out. There are so many NGOs who require the help of medical students or doctors, to treat poor, needy patients. So you can do voluntary work there. Yeah, work in a startup when you have some time off during your summer vacations. Do some part-time internship in a startup. If we can't find a mentor, how can we approach research? Well, that's difficult. You really need somebody to guide you well, and which is why see who all are interested in research in your hospital, and then go about contacting them and taking their help. Without that, it's very difficult to start publishing all by yourself. All central institutes will be through Next or not. I don't know about this. The guidelines are not clear. We'll get to know soon. Yes, I did publish research while applying for USMLE. I told you I had 5 publications before I was applying there. No, you can appear for the next exam again. If you don't like your rank, you would be allowed to improve your rank next year. My MBBS marks in 4 years affect my selection into PG college? Not at all. In fact, what we've seen is those who are toppers all throughout will of course do well, but the people who really shine in PG entrance exam are the ones who are in the middle of the pack, and they are the ones who really shine in these PG entrance exams. So don't be deterred if your marks in your university exams are not high. You can still get a good PG rank. So career opportunities in Gulf countries. So that's a good question. So yes, there are good career opportunities in UAE, Bahrain, Muscat. All these places have career opportunities. Um, some of these places have now started having their own exams. Like Dubai has their own exam which you have to clear before you get registered there. Other than that, other places just have an interview process and you can get selected for the job there. So it's not actually training there, it's a job, right? You're not getting trained there, you're actually working there. The good thing is that the pay is good. In some of the places, it is tax-free income. And the third thing is that if you have an MRCS or an MRCP or an MRCOG, your pay gets tripled while working there. The offer which you get is almost 3 times compared to the person who doesn't have these foreign degrees. So that is another added advantage which you have. During my MBBS, was I able to complete the whole standard textbooks? Well, some of them, yes, I read cover to cover. Namely, my Ganong I had read the Robbins cover to cover. Bailey I had read multiple times, and I never read Harrison, but yes, Davidson I read cover to cover a couple of times. So some of those books you need to read cover to cover, but for other books, you can leave out the fringe topics and just focus on the high yield areas. So hospital administration, yes, good question. So one thing which I want to tell you, I told you MBA is a good opportunity where you can, there are good job opportunities after that. Some of the job opportunities after MBA will be in the health administration side as well. Now, if you compare somebody who's done an MBA and entered into hospital administration versus somebody who's done a hospital administration course, an MHA, and entered hospital administration, the person who's done an MBA would always be given higher preference, right? So just be clear about this thing. After doing a health administration course, you will become an MS or first a deputy MS and then a medical superintendent. But to really climb up high in the ladder of administration, an MBA is better. So Ayush is saying, does the college for post-graduation matter? Well, again, like I said, Ayush, to a small extent, yes, but that doesn't mean that people who are doing their post-graduation from other institutes are not doing well in life. In fact, I know so many people, those who've done their post-graduation from a tier 2 city, and still their practice flourishes and they are excellent clinicians. So don't get disheartened if you're not in the best, if you're not in the best center. But yes, you can still achieve your dreams. So don't get disheartened if you don't get selected into the best institute. Try to get selected, but if you can't, you can still do well in life. Is racial discrimination a major problem after getting residency in US? Not in the major cities. Yes, if you do get a seat in the peripheries and some of the states, it is a slight problem, but I won't say majorly it's not an issue anymore then. Plastic surgery is an excellent opportunity. You know, so much of cosmetic work is being done. A lot of children with cleft lips, cleft palates. So a lot of girls are taking up plastic surgery and pursuing it as a career option. Has good opportunities in future. Okay. So best colleges for Obs Gynae in Delhi are going to be Lady Harding, Mamsi, Safdarjung. I've already spoken about Australia. Private versus government sector jobs in India. Okay. So government sector jobs, there is stable growth. Once you get into the system, you know that you will get a promotion at regular intervals and growth is going to be there. And uh, pre-COVID, it was kind of a relaxed working environment. You go do your work, then come back home. Of course, during COVID, the people who are working in the government setup are the ones who are facing the real music, and hats off to their work and their dedication during this period. The private sector, on the other hand, sky is the limit. You know, when you enter into the private sector, you can really flourish and achieve all your dreams. Government sector also, one thing which can be troublesome is the politics which goes on in these government sector jobs. So that can be a deterrent for some of us to take up those jobs. Okay, so emergency medicine, yes. So emergency medicine is coming up as a great branch in India. Of course, still the setups are not fully established, but with the setting up of the AIMS Trauma Center, and they're starting now they've started a post graduation in emergency medicine there. So things are really going to improve in the future, and with more and more nodal trauma centers, once they are set up, things would be better. Again, emergency medicine is a job where you have shift hours. So you just have a shift duty, say for 8 hours or 10 hours, and then you don't need to follow up with the patient. It is a very demanding job. So again, adrenaline junkies who really want to stay active all the time, and they are willing to take care of patients who come in the emergency. They're very sick, and if you're willing to really take care of such patients, then you can pursue this branch. Okay, so I think so I've answered all these questions. Okay, so yeah, I think so I've cleared up these questions. If there are any other questions, I'll be happy to answer them. All right. Scopes of pulmonology. Pulmonology is also, it has been a good branch over so many years. And with COVID coming in, I think so the scope of pulmonology will just increase in the future. I can be contacted. My email ID is Rohan Khandelwal at gmail.com, or my Instagram handle is docrohan83. I'm most active there in terms of replying to personal questions, because Facebook sometimes the messages get lost. So Instagram docrohan83 would be the best place to send me a message where I can reply. Best oncology institutes for post-graduation in oncology will come. If you're doing radiation oncology, that is the only thing which is going to be a terminal branch. So of course, radiation oncology, I always say it is better to do a DNB than to do a post-graduation, because the private setups have better radiotherapy machines than the government setups. So places like Tata Memorial and even the corporate hospitals, the learning is better there when you're learning the radiotherapy techniques. It's not difficult to clear the Canadian exam. The Canadian exam is a bit easier than the USMLE exam. Okay, right. So I think so I've addressed, keeping in mind the present situations like COVID, the riots in USA, is it good to choose USMLE? Well, I still have a few juniors who've gone and taken up residencies this year, and there are no such problems there. So you can still go ahead and take the thing. Was I a topper in MBBS? I topped the second year, but yes, I was within the top 10 students in my class. Not always coming first, but yes, amongst the top 10. Really doesn't matter. Nobody is going to, none of your friends are going to ask you this. Nobody is going to ask you this after 10, 12 years, whether you were a topper or not. So it's best to, build concepts during MBBS. You should learn how to treat patients. That's more important than whether you were a topper or not. Right. So I think so. Address most of the questions. Best options for obs-gynae aspirants. So I've told you the top colleges, and obs-gynae also. Infertility is the thing which is in huge demand these days. So you can do a fellowship after your obs-gynae. Pediatric study opportunities abroad are excellent. UK, a lot of opportunities for pediatrics, and even in America, you can get a good residency. Okay, how to stay motivated during your preparation for any exam, whether it is PG entrance or USMLE. So look, there are different types of people. Some of the people are self-motivated, where you don't need external influence to tell you that you have to achieve this job. If you're that kind of a person, my best advice to you is just note down your goals, what your goals are, make down a planner and just stick to it. But if you think that you're losing attention and you're losing focus on a regular basis, then you can reach out to so many mentors which are available online, offline. You might have somebody in your college who can guide you, a senior, or people online who can help you out. So just contact any one of them, listen to their videos on YouTube, and that can be helpful. But one thing is, yes, have a very clear vision in your mind that this is my goal, this is the path which I'm going to take to achieve my goal, and please write it down. Once you write it down, things become much easier. So WHO takes in all people, right from plain MBBS to specialists as well. Of course, more job opportunities for community medicine guys, pediatrics, community medicine, obs-gynae. Right. I think I've answered all the questions. So in the end, I would just like to say, look, there are plenty of opportunities, and whatever opportunity or whatever path you choose, you need to be truthful to yourself, and there will always be ups and downs. Don't get deterred by those ups and downs. Life is a sinus curve. You have ups and downs. So whichever path you take, just stick to that path, and in the end, the result is going to be good. Don't think about factors like how much money is there or how much am I going to earn on day one? Of course, when you start something, you earn less. But if you are good at what you do, then sky's the limit in each branch. Okay. Yes, you can appear for USMLE. It's not as if the USMLE exam is going to stop because of COVID. Even this year, they are going to conduct virtual interviews. They won't have physical interviews where you need to go to US. You can do the interviews virtually as well. So no problem at all. All right. Thank you, everyone. I've shared my contact details. I've told you Rohan Khandelwal at gmail.com is my email ID, or DrRohan83 is my Instagram handle, or you can find me on Facebook. If you want to send a personal message, do it on Instagram. That's where I'm most active in replying to personal messages. Thank you.
Thank you, sir, for this wonderful session, for letting us know and empowering with us with knowledge of the various aspects that we may come across after MBBS. Expressing all-heartedly our gratitude on behalf of IMA-MSN for taking your precious time with us. A word from our sponsors too. Thank you, Maro, for sponsoring this event. Thank you, sir. Thank you all.
Thank
Have a
you.
good night.
Thank you. Good night.